All right, gonna get started. I want to thank everyone for taking the time this wonderful morning to come to this important conversation about policy solutions for Native communities to prevent substance use disorder and overdose. Also want to say that this briefing is hosted in collaboration with the Global Health Advocacy Incubator. We want to thank them for their efforts in helping make this happen. To introduce the speakers today, my name is Jeremy Grabiner. I am the Associate Director of Policy here at the National Council of Urban Indian Health, which our acronym is NCUIH. You'll probably be hearing that a lot during the presentation. And then I'm joined by Kerry Hawk Lessard, who is a NCUIH board member, as well as the Executive Director of a Native American Lifelines, which is an urban Indian organization in Baltimore and Boston. Before we begin, do have a couple housekeeping items. We will be recording this for external dissemination. And if you have any questions, you can type them in the question and answer tool, or if you raise your hand, you will be unmuted and be allowed to speak. We will get to the questions kind of at the end of the briefing. Just an overview of where we're going to cover. We're going to talk a little bit about NCUIH and urban Indian organizations, the impact of opioid use and substance use disparities in American Indian, Alaska Native communities. And then Kerry will touch on Native American Lifelines, the work that they're doing on the ground and what's making a difference. And then just end it with some opportunities for congressional action in support of policy solutions. So NCUIH is a national representative of the 41 urban Indian organizations that are contracted with the Indian Health Service under the Indian Healthcare Improvement Act. More than 70% of American Indian Alaska Native people now live in urban areas, and UIOs are an integral part of the Indian healthcare system, which is comprised of IHS facilities, tribal facilities, and UIOs. UIOs were created by urban American Indian Alaska Native people and with support of tribal leaders beginning in the 1950s in response to severe problems with healthcare, education, employment, and housing caused by federal government's relocation policies. Today, UIOs provide essential healthcare services, including primary care, behavioral health, and traditional healing services to American Indian Alaska Native people living in urban areas across 22 states. Now, a little bit about the crisis that is felt. First, want to touch on the life expectancy of American Indian Alaska Native people, which in 2022 was actually lower than the life expectancy of the general population in 1950. And on the topic of substance use disorder and overdose in our communities, our American Indian Alaska Native communities have been hit harder than any other population. So the American Indian Alaska Native people experience the highest rates of overdose deaths in this country. The rates of substance use disorder are nearly twice the national average. Now, despite these disparities, the resources available to respond are often very limited. And that's why we're here today to highlight both the urgent needs and the solutions that are working on the ground. IHS facilities, tribal facilities, and UIOs do provide life-saving substance use disorder and behavioral health care, culturally tailored services, support groups, and outreach. Now, to get a little bit on the on-the-ground challenges into perspective, I'm going to be honored to turn it over to Kerry.
Thank you, Jeremy, and good morning, everyone. Again, my name is Kerry Hawk Lessard, and I'm the Executive Director of Native American Lifelines. We are a Title V urban Indian health program serving in Baltimore, Maryland, and Boston, Massachusetts, and we are an outreach and referral program. What does that mean? That means that we don't provide direct medical care. However, we do provide robust health promotion, disease prevention work, but importantly, we do provide direct dental care and direct behavioral health services to folks living in our community. It's our mission at Native American Lifelines to promote the health and social resiliency within the urban Indian communities. And to do that, we apply principles of trauma-informed care to provide culturally centered behavioral health, dental outreach, and referral services. I want to draw your attention to the last part of that. the culturally centered behavioral health programs, actually everything that we do is grounded in culture. As a grad student, I had the opportunity to participate in a Center for Substance Abuse Prevention project at Native American Lifelines. Initially, it was to look at HIV risk, but what we uncovered through that is that folks in our community identified three primary drivers in their inability to achieve and sustain wellness, but also things that were driving their mental distress and substance use disorder. And they identified first disconnection from culture. The second thing they identified was feeling invisible as Native people in a majority non-Native city like Baltimore. And third, they talked about the experience of lateral violence. What do I mean when I talk about that? I think what we're seeing right now, Senate Committee for Indian Affairs, there's a lot of rhetoric around the Lumbee Fairness Act that gets pretty heated and can make people feel like they don't belong. Baltimore serves a large number of Lumbee tribal members. In fact, Maryland has the highest population of Lumbee tribal members outside of North Carolina. And so hearing from our relatives that feeling that they were disconnected or not seen as Native people was really fueling their substance use disorder and then creating a whole host of other problems, including infectious disease in our community. And in the recent years, a wave of fatal opioid overdoses that really hit our community in a very significant way. And we can move to the next slide. Thank you. So what do we do and how do we treat those issues that I just discussed? We focus on tertiary prevention, so really trying to identify the issues and prevent them from becoming larger issues. And again, talking about how our community members told us very clearly that they need everything to be rooted in traditional ways of knowing and being, valuing Indigenous knowledge, and supporting traditional wellness practices. And one of the biggest ways that we see that is through our behavioral health and our cultural support programs. So you're seeing program flyers here and photos on this slide that show sort of what we do and how we do it, but we really do try to incorporate traditional medicines for our people, traditional healing practices, whether that is sweat lodge or talking circles or work through art to make sure that we are meeting the physical, the spiritual, the cultural, and emotional needs of Native people living in urban areas. The center photo that you see is really addressing the opioid overdose and the opioid abuse crisis that we experienced in Baltimore. Again, we understood that people might not come out to, learn how to use Narcan, learn how to use an opioid, or learn how to identify an opioid overdose, but they would come to engage in culture, and that's really been the high point of the work that we do. We experienced a wave of fatal opioid overdose deaths during the last federal government shutdown. We lost about 12 relatives in that period. That is very personal to me because I grew up in this community and I have a personal relationship with every single person that died from a fatal opioid overdose. And so to address that need, I want to highlight one of the projects that we did and one that's reflected in the photo in the middle. And that was a project that we called Keeping the Heartbeat Strong. We know that for Native people, the drum represents the heartbeat of the earth, and it's very important to us. And we treat that drum with medicine, whether the medicine is tobacco or the medicine is the songs that we sing. And so making the analogy between the actual drumming and the heartbeat that we all carry and the loss of that heart that we could experience through a fatal opioid overdose or any type of opioid overdose, and the way we use medicine, being Narcan, to treat that and to keep our heartbeat strong. And so we worked with a member of our community from Fort Belknap who sits in a medicine drum society and led community members through making a hand drum and talking about the ways that that can be used, whether it's drum-assisted recovery therapy for Native Americans or DARTNA, or just for personal use. and how we care for that, but then a strong partnership with the Baltimore City Health Department to then come in and talk about how we identify opioid overdose, what types of treatment availability there is, and then very importantly, how we use Narcan. You may not be able to see this on my water bottle, but it's a sticker that we gave to everybody. It says, I carry sage, cedar, and Narcan. And we want people in our community to think of Narcan just as importantly as we think of the other medicines that we use in our culture. Now, some of the challenges that we have to keep these programs growing to meet the needs of our community is that we have severe underfunding. You saw from the pie charts that just 1% goes to the urban Indian line item. I'm grateful for folks in the Billings area where I have family that support urban Indian health programs, but in our Nashville area, for example, the urban Indian line item is not voted to increase. We are one of 3 programs on the East Coast in the Nashville area office that offer urban Indian health care. That's it, and it's a huge area. So, while we're trying to partner also with tribes that are in our area, like the Mashpee, that may have capacity issues to address opioid overdose, having the requisite amount of funding that we need to do what we need to do is really important. We also experience workforce shortages, being able to find, because all of our relatives, they really want to have Native providers. So how do we identify Native providers? What are workforce development pipelines or educational pipelines that make those providers available to us? And then how do we pay them a living wage? And then how do we bring in elders or other cultural experts to offer that culturally specific care? We also have very fragmented federal funding streams, and we have reliance on grants that may disappear. The OMB memo that came out at the beginning of the year was very scary for us, but luckily we had support from tribes, from legislators, from organizations like NCUIH to highlight the fact that these trust and treaty obligations that the federal government has to Native people are things that we can't sever. So really trying to kind of put together and do patchworks of funding that can really lead to a lack of sustainability and being dependable and having relatives know that when they need us, we are there for them is really important. I mentioned early that in the last federal government shutdown in 2019, we were not able to provide the level of care to our relatives that we needed because we didn't have the funding to do that. And again, this is a high time of need for our community when we were losing people sometimes twice in a week to fatal opioid overdose. And so we are really grateful for advance appropriation, especially right now during another federal government shutdown, which means that we can continue to be available to the relatives that need us. And other urban Indian health programs and direct IHS programs can be available. I know that my family uses both urban and direct IHS services, and so I am personally very grateful for advance appropriations to make sure that those needs are being met. What's important for us is that we really need to have sustainable programs. So that means consistent resources that are going to allow our UIOs to sustain interventions that work. And we know that this type of culturally grounded work is important and desired by our community. Because if we're creating health programs that aren't engaging, people are not going to show up and they're not going to get the very needed healthcare information that is going to help them to be healthy and to know how to respond in times of crisis in the community. That federal investment really does translate to lives saved in American Indian and Alaska Native communities, and I really can't overestimate the importance of that. Again, this is a trust and treaty obligation, and I am grateful that our relatives have access to these services. We need to make sure that they're funded at the level that they need to be funded so that we can do the work and save lives. If we have our relatives dying, They're the ones that bear our culture. They're the ones that speak our languages. They're the ones that sing our songs. And that's really what we tried to emphasize in terms of opioid overdose prevention or any type of substance use disorder work that we do, that, not just are we taking care of our bodies, but we are taking care of those things that need to be passed down from generation to generation, because we know they keep us well and we know that they heal. So I can't really say enough about the importance of these types of programs and making sure that they're funded, but more importantly, not just taking my word for that, but hearing from our relatives that this is what we need. And more importantly, this is how we need it. This is how we need healthcare systems to work for us as Native people so that we can have the highest possible quality of life. We also need our legislators, especially at our state levels, but also in partnership with our federal legislators, to make sure that Native people are being counted. In Baltimore City, a person can go to get care for substance use disorder, to access Narcan, and they can be white, Black, Asian, Latino, or other. And so if we are not being counted, I am not able to tell, let's say Senator also Brooks' office asks me the impact of a problem like this in our community. I can give anecdata. I can tell what is being told to me or what we're seeing in our community, but having the data to report up so that you as legislators or working for legislators understand the impact of the problem in our community is really important. So we need all of those things to work together. And again, not to sound like a broken record, but making sure that we prioritize urban Indian health, because it serves all of our relatives. Your status as a tribal citizen doesn't change just because your zip code changes. And so when you're moving away from your reservation community, you need access to the services that urban Indian health programs do provide. So I think I'm going to close by saying that much. But Jeremy, I'm going to hand things back over to you.
Thank you, Kerry, for sharing that and the work that you're doing on the ground. I'm just going to quickly kind of touch on some of the solutions and opportunities from the congressional perspective on this issue. I'm going to start with some items that currently are funded in Congress that are important to protect. So first up is the Native Connections Grant. So this is a 5-year grant program that supports suicide prevention and substance use disorder programs for American Indian and Alaska Native youth. It is important that this funding is protected. Currently, both the Senate and I know it's kind of odd to be talking about appropriations right now in the middle of a shutdown and uncertainty of where the funding is going to go and what the package will look like. But I wrote this before there was a government shutdown. But both the Senate and the House have maintained funding for this program. It is in the Labor H appropriations bill. The Senate maintained at the current level of 23.67 million, while the House had a proposed increase funding for 30 million. Our support, of course, is to increase and to match the House number, as this program really just has been instrumental across the country for both tribal programs and urban Indian programs. Along with that, there's the SAMHSA Tribal Opioid Response Grants, which is a lifeline for prevention and treatment needs to have continued and expanded support. One of the new requests from the president's budget this year was for the Behavioral Health and Substance Use Disorder Resource for Native Americans program, or as we call it, the SUNDRA. And this was a program that was authorized by Congress in the Appropriations Act of 2023. However, it was not appropriated. So the program provides services. It was authorized to provide services for the prevention of, treatment of, and recovery from mental health and substance use disorders amongst American Indians, Alaska Natives, and Native Hawaiians. So the funding was authorized, but it was not appropriated. The request was 80 million for the fiscal years at that time, 2023 through 2027. No funds have been appropriated for this program. It was included in the president's budget, but neither the House nor the Senate have included this in their appropriations bill for FY26. And then lastly, we just want to make the highlight, as Kerry mentioned, the funding is limited, and with UIOs receiving 1% of the IHS line item, as you heard, Kerry's doing a lot with limited funding, but any opportunities to increase dedicated funding for UIOs to address behavioral health and substance use is something that we welcome and support. I'm now going to turn it over to see if there are any questions. As I mentioned, there are two ways you could write a question in the question and answer tool, or if you raise your hand, someone on our team will unmute you and allow you to talk. So whichever way you would like to ask questions, and if there are no other questions, we will end. But I'll give a couple minutes, or a minute or two, to see if anyone has a question. Okay, we have a question about the impact that the current shutdown has had on UIOs, and I can start out by answering that. I just want to say it was in bipartisan support in securing advanced appropriations for IHS, because as Kerry could share, there was deadly impacts of the last government shutdown, with limited services and some UIs having to close. And this shutdown, the impacts really have been mitigated by the the advanced appropriations. Of course, with everything, people are being mindful of funding, but the funding from IHS has flowed without delay, which has been helpful. And so far, we have not heard of any UIO having to reduce or cut down their services. So the impact has been limited, specifically because UIOs receive advanced appropriations through IHS. There are concerns, if there are potential risks on staff that serve tribal and UIO programs, but that, I think is a little bit of a separate conversation. Then the next question is on which president.
Jeremy, could I actually
Yes, please.
add to that?
Yeah.
About impacts, our Baltimore program is in an area where there are a lot of tribal citizens who work for the federal government, and they are RIFT right now. And so we are seeing an increase for services, people that have decent incomes, that have good insurance, that maybe don't use UIOs, are now reaching out to us for support. So again, when we have a smaller funding stream, but then we see that increase in services and that high level of need, especially as the shutdown goes on, then that does impact our program, because we're already doing a lot with little. We have to do more with little. So I apologize for interrupting.
No, thank you for sharing that. The next question is on which president requested the funding. So it is in President Trump's FY26 president's budget. Then this question is for you, Kerry. Can you share success stories of UIO advocacy to the federal government? What role does advocacy play?
I think advocacy is really important, and kind of in our areas, having good relationship with our legislators and their staffers. I will say that during the last federal government shutdown, again, we have a program in Boston. These impacts we were really feeling, and Senator Warren took to the floor to talk about Native American Lifelines of Boston specifically, and the impacts on the elders in our community and our inability to meet those. And by speaking specifically of our program, Senator Warren created change with our Nashville area, but also, brought to light the issue of urban Indian health programs and, the ways that we were being impacted. But just being able to talk with our legislators about the number of tribal citizens that we are seeing, in our Baltimore program, the highest users that we have of our dental program, for example, come from the Navajo Nation. We are not in the Navajo area, but we are serving a lot of Navajo tribal citizens. So just letting people know of the reach, again, we are caring for your relatives. And so having relationships with legislators in both of those areas, and then relationships with a legislator like Senator Tom Tillis to make sure that we are supporting the work that he is trying trying to accomplish that's going to benefit our relatives, it really makes a difference because people don't think about urban Indian health. And we need to be able to tell our stories so our legislators understand the importance of the work that we do. And then once they hear those stories, they are able to respond in ways that are supportive, and it does mean a lot.
Thank you, Kerry. Are there any other questions? As I mentioned, you can put in the question and answer, or if you raise your hand, someone on our team should be able to unmute you if you'd like to ask your question verbally. Okay, I think that's it. I want to thank you all so much for joining us for this briefing, for the opportunity for Kerry to share what's on the ground. And we really appreciate the work that everyone who's joined is doing, and we look forward to collaborating with you in any future endeavors. Thank you so much. Have a good day.